Good morning, all of you. Today we shall discuss about the blood pressure control mechanisms. In the last class, we had just talked about the definitions of the blood pressure. How do you define blood pressure? What are the variants of the blood pressure? We had talked about the systolic blood pressure, the diastolic blood pressure, mean arterial blood pressure, pulse pressure. We also had talked about the factors which are affecting the blood pressure, where we had discussed that there are two factors. One is the cardiac output and other is the peripheral resistance. We also had discussed about the factors on which the peripheral resistance depends and also the factors which are affecting the cardiac output, that is the stroke volume and other parameters. Today, we also had discussed in the last class about the physiological variations in the blood pressures with respect to the male-female variation, the age variation, and with the diurnal variations, exercise, posture and other factors. Today we shall see what are the mechanisms in the body which are maintaining the blood pressure at a constant rate. We know that, remember the first classes we had said that homeostasis, the body tries to maintain a constant internal environment. That means homeostasis is to be achieved. That means whatever may be the variations, the body tries to see to it that the blood pressure remains within a constant normal level. For any reason, physiological or pathological, if the body tries to go away from this normal set parameters, then there are certain mechanisms which will come into play to see that the parameters come back to normal, which is called as homeostasis. Here also, with respect to blood pressure, we know that the normal blood pressure is somewhere around 110 to 130 systolic, around 70 to 90 diastolic, commonly we say 120/80, but there are certain instances when the blood pressure may go out of this range. So as soon as the blood pressure goes out of this normal set range, say example if the systolic goes above 150 mmHg or on the lower side it comes below 100 or 90 mmHg systolic, immediately certain mechanisms will be activated in the body which will see to it that the blood pressure comes back to normal or is brought back within the normal range. Now, these mechanisms, let us see in detail what are these various mechanisms which help the body in maintaining a normal blood pressure. Apart from the system, it is also a time factor which plays a very important role in regulating the blood pressure. For instance, the blood pressure may be changed or may fluctuate temporarily as you change a posture. Say for example, if you are lying down and you stand, suddenly you will find that there is a drop in the blood pressure. We say that the blood pressure falls down above the heart level and below the level it increases. So there is a sudden drop or a change in the blood pressure when there is a change in posture from lying down to standing posture. So immediately at this point of time, there are certain mechanisms or reflex mechanisms in the body which will detect. First, it will detect that this blood pressure has deviated from the normal parameters, and then it will activate certain systems within the body to see that the blood pressure comes back to normal. So one is a very short-term mechanism or a short-term regulation of blood pressure, where you will find that the blood pressure variations are happening for a short time, and the blood pressure mechanisms also are so set that they help to control the blood pressure over a short period of time. This is called as the short-term regulation of blood pressure, or it is the mechanisms which are helping the blood pressure remain back in normal or bring back to normal in a short span, rapid regulation of blood pressure. Then there may be instances that the blood pressure remains high for some few minutes to few hours. So that is called as intermediate regulation of blood pressure, and there are certain mechanisms where the blood pressure remains high for a long period of time and the body has got a different mechanism to bring the blood pressure back to normal. So basically the blood pressure control mechanisms are divided into three. One, a short-term regulation, then an intermediate regulation and a long-term regulation. Basically, we will focus our discussion on the rapid regulation or the short-term regulation and the long-term regulatory mechanisms. Now, to understand how these blood pressure regulating mechanisms are functioning, briefly we may need to go back to the physiologic anatomy of the innervation of the heart and the circulatory systems. So we know that the whole of the circulatory system, which includes the arteries, the capillaries and the veins, and also the heart, are supplied by nerves. Now, if at all the blood pressures have to be brought back to normal, 2-3 activities have to be regulated. One, the redistribution of blood flow has to occur. That means wherever there are storehouses of the blood, where there are reservoirs of the blood, those reservoirs of the blood has to be reactivated or emptied, so that the blood from the storage houses or from the reservoirs enter into the circulatory system. They do not remain as storage, but they enter into the circulatory system, and there is a flow so that they affect the blood pressure. In other words, by redistribution of blood flow, we means that the venous return should increase. If the venous return increases, then the blood pressure can increase. Similarly, increase pumping activity of the heart. The other mechanism by which the blood pressure can be increased, if there is a fall or a low blood pressure, it can be increased by increasing the force of contraction of the heart. That is, the stroke volume is increasing, the force of contraction is increasing, so the blood pressure can increase. The other thing is, how do you get a rapid control of arterial blood pressure? How do you bring that pressure which has gone down back to normal within a few seconds, or if it has gone above, bring it back to normal or bring down within a few seconds? This mainly is done via the autonomic nervous system. Remember one thing, that very short-term regulation or the rapid regulation of blood pressure is via the nervous mechanism. The long-term regulation is basically by means of an endocrine mechanism. Now let us see how the innervation of the circulatory system pans out. Now here you can see that the whole of the circulatory system and the heart is supplied by autonomic nervous system. The autonomic nervous system has got two divisions. One is the parasympathetic division and the other is the sympathetic division. Now the sympathetic nervous system not only innervates the circulatory tree, but it also innervates the heart. Whereas the parasympathetic nervous system do not enters into the circulatory system or does not affect the vascular tree, but only affects the regulation of the heart. So sympathetic nervous system innervates both the heart and the circulatory system. Parasympathetic nervous system is basically regulating only the cardiac function. Now coming back, if you go back to the class, remember the autonomic nervous system where I had discussed about the innervation of the heart, where I had said that the parasympathetic nerve supplied to the heart is through the vagus nerve. So basically the vagus nerve is the parasympathetic nerve which innervates the heart, and within the heart it basically affects the conducting system of the heart. That means the fibers of the vagus nerve innervates the SA node and the AV node. So the vagal response, the vagus supply to the heart mainly affects the heart rate. Either a strong vagal stimulation can bring down the heart rate to such an extent that the heart may stop beating. So decrease or increase of the heart rate depends upon increase or decrease of the vagal tone. Increase the vagal tone, the heart rate falls. Decrease the vagal tone, the heart rate increases. Whereas on the other hand, the sympathetic nervous system also affects the heart and the circulatory system. Within the heart, it not only innervates the conducting system of the heart, but also affects or innervates the cardiac muscle, that is the ventricular muscle, the left and the right ventricles. So basically, when there is a sympathetic stimulation, it increases the heart rate and it also increases the force of contraction. Whereas on the circulatory system, if you see that the sympathetic fibers are coming from the thoracic segments of the vertebral column, and they innervate the arteries, the large arteries, and to an extent they affect till the peripheral arterioles. When they affect the peripheral arterioles, in fact means that a strong sympathetic stimulation will cause vasoconstriction of the arterioles, When it causes vasoconstriction of the arterioles, that means the size of the arterioles is reduced and the resistance offered is increased. So when the peripheral resistance is increased, it means the diastolic blood pressure is increased and the blood pressure, total blood pressure increases. Whereas if there is a decrease in the sympathetic stimulation, there is an increase in the size of the peripheral arterioles. The size of the diameter of the arterioles increases. And the diameter of the arteriole increases, it means that the resistance falls, the diastolic blood pressure falls, the blood pressure falls. So in other words, an increased sympathetic tone will cause an increase in the arterial, cause increase in the peripheral resistance, and also increase on the heart, the force of contraction. Whereas a decrease in the sympathetic tone will cause vasodilatation, a decrease in the peripheral resistance, decrease in the diastolic blood pressure, plus the force of contraction is reduced, as also the heart rate comes down. So basically, the autonomic nervous systems regulates the blood pressure by two ways: a sympathetic tone and a vagal tone. An increase in the sympathetic tone increases the force of contraction, increases the peripheral resistance, whereas vagal tone, an increase in the vagal tone will decrease the heart rate, a decrease in the vagal tone will increase in the heart rate. Now this is about the few words about the sympathetic nerve fibers. The sympathetic nerve fibers here you will find that will innervate all the vessels. Here this is the large artery, this is the arteriole, this is the capillaries, this is the venules, and these are the veins. So when you see the sympathetic nerve fibers, they are innervating the arterioles and the arteries. It may be a large artery or a medium sized artery or a small arteries. It also affects the arterioles, but there is no innervation in the capillaries. Whereas on the venule side, it affects the venules and the veins, the small veins, the medium sized veins, and the large veins. In other words, when there is a sympathetic stimulation, there will be a vasoconstriction, so that the size of the artery is reduced. There will be effect on the arterioles, where the size of the arterioles will be reduced. The resistance will be increased, whereas the veins also will constrict. When the veins constrict, the size of the veins will also reduce. So what is happening when you see an increased sympathetic tone? When you see an increased sympathetic tone, two things will be happening. On the arteries, vasoconstriction, increasing the peripheral resistance, increasing the diastolic blood pressure. Whereas when there is a venoconstriction, that means the veins are getting constricted, it is pushing more and more blood to flow into the circulation. That is, the veins have the capacity to store blood. When they are getting constricted or they are getting narrowed down, the capacity of the veins to store the blood is reduced. In other words, it is causing an increased blood volume to be in the circulation. That means the venous return is increasing. When the venous return is increasing, you will find that the stroke volume also increases. So in this way, the sympathetic tone affects the arteries and the veins. Whereas the parasympathetic nervous system is mainly responsible to control the heart rate. Here you will find this is the sympathetic trunk, the sympathetic nerves are coming out from there, they are innervating the heart and they are going into the periphery to affect the vessels. Here you will find that is basically you will find that T2 to L5 is the sympathetic tone, where sympathetic chain. From there you will find that the sympathetic nerves come out. The sympathetic nerves then, when they are coming out, they innervate the heart. This is the ventricle, they innervate the conducting system. Then they also innervate the arteries and the veins. Simultaneously, they also carry signals to the higher centers, that is called as the vasomotor center. Now in the vasomotor center, there are two areas. One is called as the vasoconstrictor area and the vasodilator area. This is present at the junction of the pons and the medulla. Basically, two areas are there: the cardiac areas and the vasoconstrictor area and the vasodilator area. The vasoconstrictor area and the vasodilator area are together called as the vasomotor center. In addition to this, there is a separate area which is known as the cardiac areas, and this is the cardiac inhibitory area where this is innervated by the vagus nerve. So any signals coming from the heart will go up also to the cardio-inhibitory area. They will stimulate the cardio-inhibitory area. When this area is getting stimulated, it sends signals down to the vagus nerve, and through the vagus nerve, it causes inhibition of the heart or decrease in the heart rate. Whereas coming on to the vasomotor area, there are two areas. One is the vasoconstrictor area, vasodilator area. Whenever the vasoconstrictor area is getting stimulated, it causes vasoconstriction throughout all the blood vessels. Whereas whenever there is a stimulation of the vasodilator area, it causes vasodilatation of the blood vessels. Normally, among the two, the dominant is the vasoconstrictor area. So normally there is an amount of vasoconstriction present. This vasoconstriction contributes to the peripheral resistance and to the diastolic blood pressure. The vasoconstrictor area also has got an inhibitory effect on the vasodilator area. So whenever the vasoconstrictor area is stimulated, it not only stimulates or causes the vasoconstriction all throughout the body, it also inhibits the vasodilator area. The vasodilator area comes into play when it is stimulated or when there is inhibition of the vasoconstrictor area. Inhibition of the vasoconstrictor area will cause the vasodilator area to become activated. When there is an activation of the vasodilator area, there may be vasodilatation, decreased peripheral resistance and fall in the diastolic blood pressure. So basically we have seen two things: sympathetic nerve fiber to the heart and to the circulatory system, innervation of the parasympathetic nerves to the heart. Then above we have seen the higher centers are there, two higher centers are there, the cardiac areas and the vasomotor center. The vasomotor center has got two areas, the vasoconstrictor area, vasodilator area. Stimulation of the cardio-inhibitory area will cause depression of the heart through the vagus nerve, whereas stimulation of the vasoconstrictor area will send signals down through the sympathetic nerves to cause vasoconstriction. The vasoconstrictor area also has got an indirect effect of inhibiting the vasodilator area. Once the vasoconstrictor area is inhibited, that means that the vasoconstriction is less. When there is less vasoconstriction, it means that there is vasodilatation, or there is a stimulation of the vasodilator area, so that there is an increase in the size of the arterioles and the fall in the peripheral resistance. So this is the whole diagram which is being shown here. You will find that these are the vasomotor centers present here. This vasomotor center is now sending signals down through the vasodilator nerves and the vasoconstrictor nerve fibers. In addition to this, you will find that this vasomotor center, which is present near the pons and the medulla, is influenced by the various areas within the brain. You have got the motor center affecting the vasoconstrictor area, vasomotor center, the reticular area affecting the vasomotor center, plus surrounding areas like the hypothalamus and the other areas also cause an effect on the vasomotor center. Now, with that in mind, let us go. How is the rapid or the short-term regulation of the blood pressure maintained? Now, we know that in the maintenance of the rapid regulation of the blood pressure or the short-term regulation of blood pressure, there are certain receptors which are present in the wall of most of the arteries, but specifically in the great arteries, there are certain receptors which are embedded in the wall of these arteries, and these receptors respond to change in the stretch of the vessel wall. Hence, these receptors are known as stretch receptors, and they respond to change in the pressure. They are also called as baroreceptors. So baroreceptors are the receptors which play an important role in the short-term regulation of the blood pressure. The next question is, where are these baroreceptors present? The most important location of these baroreceptors are at two places. One, in the arch of the aorta, you will find that these baroreceptors are present. Second, they are also located at the bifurcation of the common carotid arteries. So these are nothing but stretch receptors. Stretch receptors are receptors which respond to the change in the stretch of the vessel wall. Since the stretch of the vessel wall is dependent upon the pressure with which the blood is flowing within these vessels, they are also known as pressoreceptors or baroreceptors. The one which is present in the arch of the aorta is known as the aortic receptor. The other, which is present at the bifurcation of the common carotid artery, is known as the carotid sinus receptors. So two receptors are basically helping in regulating the blood pressure within the normal range, and they are the baroreceptors in the aortic arch and the other is in the common carotid artery. Now these baroreceptors are sending signals directly to the brain. So the response of these stretch receptors is mediated via the impulses or signals transmitted from these receptors through the nerves to the vasomotor center and to the cardiac centers. Now what is the feature of these baroreceptors? There are two important features of these baroreceptors. The baroreceptors are tonically active receptors. That means that they continuously detect the change in the blood pressure. They respond only to changes in the blood pressure. If there is an increase in the blood pressure, the increase in the blood pressure will cause increased stretching of the vessel wall. When there is an increase in the stretching of the vessel wall, these stretch receptors or the baroreceptors will get stretched. When they are getting stretched to more than normal levels, they will send signals through the nerves, that is the hearing nerves and the sinus nerves, to the vasomotor center and to the cardiac centers. These centers, in response to the stimuli, will initiate certain mechanisms or reflex mechanisms to see that the blood pressure is brought back to normal. On the other hand, if there is a fall in the blood pressure less than the normal, the stretch of the arterial wall will be less stretching of the arterial wall. Less stretching of the arterial wall will be meaning that less stretch of the stretch receptors. This again will be picked up by the baroreceptors, that there is a decreased pressure in the vessel wall. These baroreceptors will again get stimulated and then they will send signals to the brain that there is a low pressure within the circulatory system. Once the signals are carried to the cardiac areas and to the vasomotor center, these centers will again send signals down reflexly through the sympathetic nerves or through the parasympathetic nerves to see that the blood pressure is brought back to normal. The next important feature here is that these baroreceptors respond to only sudden changes in the pressure. That is, if there is a sudden change in the pressure, then there will be sudden extra stretching, or there will be less, if the blood pressure falls, less stretching. Only the sudden changes will be detected. A sustained change or a gradual increase in the stretch or increase in the pressure will not be detected by these baroreceptors. They get adapted to the new stretch or to the new blood pressure. Hence, the baroreceptors are helpful only in regulating the blood pressure over a small period of time or a short-term regulation. If these receptors cannot bring back the blood pressure to normal within a few hours or maximum 2 days, the baroreceptors will get reset to the new pressure and they will fail to send signals to the higher center that the blood pressure is out of range. So remember one thing, resetting of the baroreceptors will take place and the baroreceptors will get adapted to the new pressure after 1 or 2 days. Hence, they are helpful only in bringing back the blood pressure to a normal level for a short period of time or within a short period of time. So basically, to summarize, they are stretch receptors, they respond to change in pressure, they are called as baroreceptors. They will send signals to the higher centers either if the blood pressure is above normal or if it goes below normal, that is either hypertension or hypotension. Fourthly, they will respond only to sudden changes in the blood pressure. A gradual change in the blood pressure, they will not respond, and if the blood pressure is sustained at a high level for a long period of time, resetting of the baroreceptors will take place and they fail to send signals or fail to detect that high blood pressure. Now, what are the nerve fibers? This mostly would be taught to you in an anatomy class. Here are the aortic baroreceptor. This is the arch of the aorta. You find that these are the black linings of the nerve. These nerves are stretching or carrying the signals through the vagus nerve to the higher centers, that is the cardiac, vasomotor center and the cardiac centers. This is known as the sinus nerve. So the nerve which is arising from these baroreceptors and going to the higher center, that is the vasomotor center, from the aortic baroreceptors is called as a sinus nerve. Similar nerve which is going from the carotid baroreceptors and sends signals up through the glossopharyngeal nerve is called as the Herring's nerve. So basically impulses are carried by the Herring's nerves and the sinus nerves. So here is the innervation of the diagram showing here. This is the vasomotor center. You will find that this is the circulatory center or the vasomotor center. Sympathetic stimulation and the parasympathetic stimulation is going on. This is the vagal nerve. Here you will find that impulses from the heart, that is the sympathetic nerves here, are going up, that is, and to and fro nerves are there. This orange one will give you the parasympathetic nerve. Here this is the sympathetic nerve there. Similarly, from the circulatory system, whereas from the arteries and the aorta, from the arteries and the arterioles, you will find that the nerves are carried in the sympathetic trunk. From there, the sympathetic trunk, they are getting innervated. Signals are coming from the higher centers. So these are the higher centers. From the higher centers, let us say the vasomotor center, sending signals down to the spinal nerves. From the spinal cord, it is coming out and innervating the heart and the arterioles. So any change in the sympathetic tone will affect the change in the size of the veins, will affect the change in the size of the arteries and will affect the heart. Whereas similarly, any change in the vagal tone through these vagus nerves, it will affect only the heart rate. But you will see here that there is no innervation of the vagus nerve into the circulatory tree. Now what is the mechanism? With this brief idea in the background, let us discuss how they respond to the changes. So basically, whenever there is an increase in the arterial blood pressure, let us say if we assume that the person's blood pressure is 120 by 80 mmHg, if the blood pressure is increased, so what will happen? An increase in the blood pressure means increased systolic blood pressure means increased force of contraction, increased pressure in the artery. Increased pressure in the artery means increased stretching of the arterial walls, increased stretching of the aorta, increased stretching of the carotid arteries, the stretch receptors getting stimulated, the stretch receptors, that is the baroreceptors getting stimulated, the baroreceptors sending signals to the higher centers, to the vasomotor center and the cardiac center, and they then responding by sending signals down through the sympathetic nerves and the vagus nerve, so that two systems are getting affected. One, the heart is getting affected, and when circulatory effects. Let us see what are the cardiac effects and what are the circulatory effects. So when there is an increase in the blood pressure, what happens on the cardiac side? There is a stimulation of the cardiac inhibitory center. So immediately as the blood pressure is increased, the baroreceptors send signals to the Herring's nerves and the sinus nerves to the cardiac center. In the cardiac center, we have got a cardiac accelerator center and a cardiac inhibitor center. The cardiac inhibitor center gets stimulated. Stimulation of the cardiac inhibitory center will cause increased parasympathetic stimulation. Increased parasympathetic stimulation will cause, actually indirectly it will cause a decreased force of contraction, but basically there is a decrease in the heart rate. Whereas on the other hand, whenever there is an increase in the blood pressure, simultaneously there is a depression of the cardiac acceleratory center. Depression of the cardiac acceleratory center will cause decreased sympathetic stimulation. When there is a decreased sympathetic stimulation, you will find a decreased force of contraction. Decreased force of contraction means decreased cardiac output. So decreased cardiac output means decrease in the blood pressure. So two effects will be seen: stimulation of the cardiac inhibitory center, stimulation of the vagus nerve, there is a decrease in the heart rate. On the other hand, inhibition of the cardiac acceleratory center, the sympathetic stimulation is reduced. When the sympathetic stimulation is reduced, there is a decrease in the force of contraction, decreased output, and the blood pressure is brought back to normal. So here you will see that as soon as there is an increased stimulation, increased blood pressure, baroreceptors either from the aorta or from the carotid arteries are sending signals to the cardiac areas. The cardiac areas, two things are happening. One, the cardiac inhibitory area is getting stimulated, whereas the cardiac accelerator center is getting inhibited. both of this will see to that the blood pressure is brought back to normal. Then what are the circulatory effects? We know that the sympathetic effects are also seen on the circulation. So what is happening? Impulses to the vasomotor center, stimulation of the vasoinhibitory area. When the vasomotor in vasoinhibitory area is stimulated, that means there is a decrease in the vasomotor tone. A decrease in the vasomotor tone will cause decreased sympathetic discharge. A decreased sympathetic discharge means decreased dilatation. It means the decreased tone in the arterioles. A decreased sympathetic tone of the arterioles means the size of the arteries is increased. There is vasodilatation. When there is vasodilatation, there is a decreased peripheral resistance. Decreased peripheral resistance means blood pressure being brought back to normal. Now let us see the other side of the effects. What are happening when the blood pressure falls below normal? The normal systolic blood pressure is around 1 to 20 mmHg. If there is a decrease in the blood pressure, what is happening? So now decrease in the blood pressure, decreased pressure within the aorta and the carotid artery, decreased stretching of the baroreceptor. These decreased stretching of the baroreceptors will be detected by the baroreceptors, that is the stretch receptors, and they will send signals to the higher centers to see the cardiac areas and to the vasomotor areas. When they send signals, what are the effects? So two effects will be seen on the heart per se and on the circulation. Let us see what are the effects on the heart. Similarly, there will be inhibition of the cardiac inhibitory area, whereas there will be stimulation of the other hand cardiac acceleratory center. So on the cardiac effects, what will happen is we will find that there is inhibition of the cardiac inhibitory center, decreased parasympathetic impulses, the heart rate will be increased. On the other hand, there will be a stimulation of the cardiac acceleratory center. Stimulation of the cardiac acceleratory center will cause increased sympathetic stimulation. Increased sympathetic stimulation will increase heart rate, increase force of contraction. In other words, whenever there is a decrease in the blood pressure below normal, say hypotension, 90 mmHg systolic or 80 mmHg systolic, two things are happening. One, the vagal tone is reduced, the vagal firing is reduced. So when there is a decreased vagal firing, there is an increased heart rate. On the other hand, the sympathetic stimulation is happening. The effect of the sympathetic stimulation on the heart is increased heart rate and increased force of contraction. Then this leads to increased cardiac output and increased systolic blood pressure, restoration of the blood pressure to normal. Now what are the circulatory effects? The circulatory effects are increased impulses to the vasomotor center, increased stimulation of the vasomotor center, increased vasomotor tone. Increased vasomotor tone means increased sympathetic discharge. When there is increased sympathetic discharge, it is affecting two things. One, the effect on the arteries and the effect on the veins. So what is the effect on the arteries? It causes increased tone of the arterioles, increased vasoconstriction, increased peripheral resistance, increased diastolic blood pressure, restoration of blood pressure to normal. Whereas on the veins, there is an increased venous tone. Increase in the venous tone means increased venomotor tone. Increased venomotor tone means reduced capacity of the veins to store blood. So it is getting shrunken or it is getting compressed. When the veins are shrinking in size, the tone is increased. That means whatever blood it was storing is now moved into the circulatory system. So there is an increased venous return. Increased venous return will cause increased cardiac output. Increased cardiac output means increased systolic blood pressure. So here you will see, one, the diastolic blood pressure is increasing, the systolic blood pressure is increasing. So the blood pressure which was gone below 120 by 80, let's say 90 by 60 or 80 by 60, is now brought back to normal within a few seconds. So the same thing is in the form of a diagram. Increased blood pressure signals from the baroreceptors to the tractus solitarius of the medulla. Secondary signals from the tractus solitarius to inhibit the vasomotor area. When there is inhibition of the vasomotor center, what is happening? There is inhibition of the vasoconstrictor area on one hand. The other effect is the excitation of the vagal tone or the vagal center. So when there is inhibition of the vasoconstrictor area, there is vasodilatation of the arterioles, decreased peripheral resistance, decreased blood pressure. That is, blood pressure returns back to normal. When there is a vasodilatation of veins, there is a decreased venous return, decreased cardiac output, decreased blood pressure. On the other hand, on the heart, we will see that there is inhibition of the heart, decreased heart rate, decreased force of contraction. This is indirect effect. Decreased excitation of the heart, decrease. This is negative chronotropic effect, negative bathmotropic effect, and negative chromotropic effect. dromotrophic effect. So decrease in the heart rate, decreased excitability, decreased conductivity. So here you will see that whenever there is an increase in the blood pressure through the vasoconstrictor area and through the vagus nerve, the blood pressure becomes back to normal. Now what will happen if there is a fall in the blood pressure? Just imagine this decrease in the blood pressure, signals from the baroreceptors to the tractus solitarius, all the reverse things will happen. Stimulation of the vasoconstrictor area if there is a lower blood pressure, and inhibition of the vagal center. So there is the exact opposite will be seen when there is a blood pressure lower down. Now here you will see, as I said in the earlier, functions of the baroreceptor, specifically function. Here the person is lying down, suddenly he stands up. When he stands up in a straight position, there is a decrease in the central blood volume. When there is a decrease in the central blood volume, there is a decrease in the cardiac output. Decreased cardiac output decreases the arterial blood pressure. This decreased arterial blood pressure is sensed by the baroreceptors. The baroreceptor stimulates the vasomotor center. The vasomotor center now causes increased sympathetic activity. When there is increased sympathetic activity, the vasomotor tone is increased, the peripheral resistance is increased, the force of contraction is increased. So you will find that this increased sympathetic activity will bring the blood pressure back to normal. So this is how the change of blood pressure happens when you suddenly go from a lying down to standing position, and during this change in position you will find that these baroreceptors are helping the blood pressure come back to normal. Now here the clinical importance here is in uncontrolled diabetes or diabetes of a long standing duration, you will find that this reflex does not work properly. It is called as the diabetes affecting the nervous system, affecting the nerve reflexes, and it is called as autonomic neuropathy. So you will find that the first sign that the diabetic patient is suffering from autonomic neuropathy is that on the change of posture, you will find that there is sudden fall of blood pressure resulting in sudden giddiness and blackening in front of the eyes, supine hypotension, where you will find that because of the uncontrolled diabetes, the baroreceptors are not effective. The capability or the ability of the baroreceptors to initiate the reflex is little delayed. Because of the delay, the restoration blood pressure will take some time to come back to normal. In the intervening period, for the few seconds, you will find that there is a temporary hypotension, and this temporary hypotension causes sudden giddiness and blackening in front of the eyes. So the clinical importance of these baroreceptors is that in autonomic neuropathy you will find that it does not work properly. Now in addition to this, apart from the baroreceptors, there are also certain receptors which are present just next to the baroreceptors, but these receptors do not detect change in the pressure, they detect a change in the chemical. So they are known as chemoreceptors. Two types of chemoreceptors are present, one in the aortic arch and the other in the bifurcation of the carotid artery. Though in both these places, these are known as the chemoreceptors because they will detect a change in the chemical composition of the blood. And what chemical composition they will detect? They will detect a change in the oxygen concentration, carbon dioxide concentration, and the pH concentration. Remember, the baroreceptors are the pressure which will detect or function within a range. That means they can effectively function when the blood pressure falls to a particular range, and the range is somewhere around 80 mmHg systolic to 150 mmHg systolic. What I mean here is, if the normal blood pressure 120 mmHg is the systolic, these baroreceptors will be able to bring the blood pressure back to normal up till 160, 170, 180. That is the range. Beyond that, the baroreceptors are not functional. They may not be able to bring back the blood pressure to normal. On the lower side, it is about 80 mmHg systolic. Till then, only the baroreceptors can help in restoring the blood pressure back to normal. If the pressure goes on the lower side below 80 mmHg or above 150, 160 mmHg, the baroreceptors will not be helping in bringing the blood pressure back to normal. So at that point of time, there are certain other receptors which will take over the function of helping the body to bring the blood pressure back to normal, and this is done by the chemoreceptors. The chemoreceptors are nothing but sensitive cells which will detect a change in the chemical composition. They are sensitive to a decreased oxygen concentration, hypoxia, or they are sensitive to increase in the carbon dioxide concentration or acidosis, that is excess hydrogen ion concentration. So whenever there is a change in the chemical composition of the blood, these receptors will stimulate and help in bringing the blood pressure back to normal. So when does this happen? Suppose if there is a low blood pressure, there is a fall in the blood pressure. The fall in the blood pressure will definitely mean that the pressure is fallen down. The fallen down pressure means the blood is moving slowly to the circulatory system. When the blood is flowing slowly into the circulatory system, that means two things are happening. There is not enough exchange of oxygen taking place, but carbon dioxide buildup is taking place. So these chemoreceptors, as the blood passes through the arch of the aorta and the common carotid, will detect that there is a hypoxia or there is an increased carbon dioxide concentration or increase in the hydrogen ion, that is a acidic pH. So once this is detected, the chemoreceptors will get immediately stimulated. The chemoreceptors will then now send signals through the herring nerves and the sinus nerve to the vasomotor center. The vasomotor center will get stimulated. It will cause increased sympathetic stimulation. The increased sympathetic stimulation will show its effect on the heart to cause increased force of contraction. On the circulation, it will cause peripheral vasoconstriction to increase the peripheral resistance, and the diastolic blood pressure is increased, hence the blood pressure is restored back to normal. So this is how the chemoreceptors come into play, but the chemoreceptors will be stimulated only below 80 mmHg. That means there is a chain system hierarchy here. If the blood pressure from 120 goes on till 80 mmHg, it is the aortic receptors which are baroreceptors which are helping in restoration of the blood pressure. If still the baroreceptors are not helpful, below that, if for any reason the blood pressure is still low, at 80 mmHg you will find that the carotid and the aortic chemoreceptors are coming into play. So there are certain non-physiological chemoreceptors are also present. You will find that there are certain chemoreceptors which are present in the lungs. They are present in the right atrium, they are present in the right ventricle, left ventricle and the abdominal viscera. But these chemoreceptors will also affect the blood pressure by stimulating the sympathetic stimulation, by causing sympathetic stimulation, but they do not respond to change in the oxygen or hydrogen or carbon dioxide concentration, but they are present or they are stimulated only when abnormal chemical substances are present. Say for example, in a myocardial infarction, there is a damage to the myocardium. Myocardium damage will release certain enzymes from the cardiac myocytes like capsaicin and the lactic acid. When these chemicals are present, these chemoreceptors will detect that an abnormal chemical substance is present in the cardiac muscle, and they will stimulate immediately the vasomotor center to cause increase in the heart rate and increase in the rate of respiration. That reflex is known as Vasomotor reflex. These non-physiologic chemoreceptors will come only in pathological conditions into play. So these are the substances. What happens when these chemoreceptors are getting stimulated, like capsaicin, prostaglandin, bradykinin, nicotine, veratridine. All these substances are present when there is a damage to the cardiac fibers or to the abdominal organ. So they causes vasodilatation, bradycardia and hypotension. So this is about the Vasomotor reflex. Three effects are seen when these receptors are getting stimulated. There is a hypotension, there is a vasodilatation and slowing of the heart rate. Other reflexes which are present are the abdominal compression reflex, the left atrial baroreceptor reflex, the pulmonary baroreceptor reflex, the Bainbridge reflex and the Mary's law. I think we will stop here. It's already 11:15. The next person is waiting. We will continue this on Wednesday. Thank you.